Good evening, ladies and gentlemen. I, Ayman Sayed, along with my co-panelists,
Sanjana
and Romana,
are glad that you could join us in our conversation with the brilliant Dr. Tammam in our session organized by Msf UAE. We would like to welcome Dr. Tammam for joining us and thank him for taking time out of his busy schedule to be here with us today.
Thank you very much for having me. All pleasure is all mine.
Dr. Tammam is a former Deputy Executive Director of Msf Access Campaign and former Deputy Medical Director of Msf Switzerland. He has published multiple works on health and medical interventions in emergencies and conflict, including on epidemic control, natural disasters, non-communicable diseases, and psychosocial support. In addition to his role in managing the medical department in MSF, he has worked on several issues related to quality of medical care in emergencies, health information systems, and medical ethics in emergencies. Dr. Tammam published a photo gallery in 2020 documenting the people on the streets of Geneva as they tried to navigate a pandemic and find their way amidst the chaos. The gallery, titled The Masked, contains images from the urban front lines of the pandemic. Dr. Tammam, we will begin by congratulating you on curating such an insightful gallery that accurately depicts the lives of the ordinary peoples of Geneva battling the pandemic. The first question we have for you is probably the most obvious one when it comes to the gallery, which is the idea or the inspiration. How did it strike you to use photography as a medium to document the impact of the pandemic? And what significance or role do you think art forms such as photography plays in the documentation and depiction of the impact of the pandemic?
Thank you very much, Ayman, for the question and for the very generous introduction. I think that takes two dimensions. One of them is I've always liked taking photos, and I've always been shy about it because taking photos is an invasive act. You insert yourself into a person's space, and you don't usually ask for permission. And when the pandemic started, and I always carry my camera around, when the pandemic started, I had my mask on, and I realized that it's less scary when people can't see your face because you can feel a bit more isolated. But at the same time, most people had masks. And I realized that this is where we are. We have found ways, intentionally and unintentionally, to exist in more and more busy spaces, but yet be more and more isolated. The mask is not voluntary, the mask is protection. But if you look at people in the streets, people are buried in their phones, and I have quite a few photos of people in masks on their phone in the streets. So there's double barrier between them and the busy streets they are in. And I realized that this is a huge change in norms. That was inserted very rapidly without any attempt to mitigate the cost of it. You can't see people's faces. You can't read their intentions. You can't see if they're smiling or threatening. You lose this whole body language that we have evolved to understand, but yet you have plenty of stuff that still tell you about people. You focus more on the eyes. You see the expressions, the body language more. And before I knew it, I'd taken plenty of photos, and I started looking at them again and again, and they tell a story. That I suppose, being in the middle of the pandemic, we got a little desensitized to, but I'm hoping that one day, hopefully when things go back to normal, people will look back and see, oh, well, there's a massive amount of documentation, this hopefully being a humble contribution that helps us re-examine how does the pandemic affect our ability to interact as humans, not only to seek or protect ourselves, to seek healthcare or protect ourselves from health risks.
Like you mentioned, you took a lot of pictures before you realized it. So the subjects of the pictures, as we've seen, are very interesting to the viewers. Was there a specific idea behind what catched your eye? Was it more in the moment kind of thing, or was there a detailed explanation behind it?
So this comes in a tradition of street photography, and the street photography is less concerned, at least historically, less concerned with the perfection of the photo as in capturing what one of the major figures of it calls the decisive moment, capturing a sense, a feeling, a position, an action in people's life that wouldn't have been seen, might have escaped attention, and be able to try to understand people through those captured moments. And that, unlike many other forms of photography, this is rare and not automatic. And this is, as I said, invasive and so it ends up being you take a lot of photos, you try to interact with the environment. But unlike a portrait photographer or a landscape photographer, you don't have a scene that is waiting for you that you can take a couple of photos and achieve the perfection you want. Here, you're, it's a scatter shot. You go back home and look at all the photos, and you might or might not find that you have actually captured something worth attention. So the 100 photos in that gallery that I've posted are 100 out of probably about 7,000 or 8,000 photos that I've taken in that year. And the same thing, I followed the tradition. Of course, that started when the cameras were still, film was still black and white, but it's still seen, at least by many, as black and white being able to express this kind of photography better. So I like this sense of this contrasting, bold, almost documentary photography that you can imagine having seen in a newspaper. And I think you guys are too young to remember the days where newspapers were black and white. But that's the impression it gives me, documenting things rather than seeking aesthetics.
I think you managed to do that really well with your photography. And like you mentioned, the main purpose was for documenting something so medical and physiological with art form, which brings us to understanding the pandemic in terms of medicine and medical access.
So, Dr. Tammam, let's start with a topic that's affected all of us recently, and that's vaccine access. So, access to the vaccine remains unequal throughout the world. Fortunately, for most of us, we have been able to get vaccinated, but throughout the world, developing countries and underdeveloped countries have been left behind in this race, with richer countries buying up the vaccine supply. So how do you think this problem can be solved, and what do you think this disparity means for the pandemic and the spread of the virus?
This is a great question. Thank you for asking. I think we have allowed ourselves in the beginning of the pandemic to be sort of dragged into this argument. Oh, the pandemic affects everywhere, hence it's an equalizer. And there are people who went and said, okay, this is what will get us all together. This is a risk that affects everybody. Obviously, that wasn't the case. It ended up being a much more catastrophic problem where there's no medical care and there's no vaccines subsequently. But also there are hidden stuff that we haven't even started to explore. You might look now and say, well, you know what? Before India got a very severe wave, most of the effect was in rich countries. So the United States and Europe suffered greatly. So what are you talking about? I think what's important to think of is that there is a cost of the pandemic that's not only in life lost because of COVID. There are still all the other diseases that are more frequent in countries that suffer from poverty and neglect and affected health systems. Those drop away. Very few people will still have the capacity to care for patients of other diseases that are less pressing, at least in terms of their urgency than COVID. It also is a problem because many of the people who got sick, even if the proportions are not high, many of the people who got sick are healthcare workers, and the sickness of a healthcare worker is much higher in the sense of its cost at the availability of care to other people. So one of the things that have become much more obvious and undeniable is that medicine and health and illness is not a biological or physiological issue only. You cannot think about it without thinking about the political, the economic, the social, and so on. It's one thing to be in a country where most of the staff, most of the people who work behind computers, hence working from home is not catastrophic. It's another thing in places where the economy is such that people have to go and work on the ground and become at risk themselves. When you have a house to lock yourself in, is entirely different from when you don't, if you live in a slum or in an area of poverty. So the pandemic doesn't only reveal the effects of a new microorganism, it reveals the effect as that interacts with the environment, and the environment is economic and is political and is social. But all that is one thing. The other is all that is part of my job that I've seen in discussions and books and papers. What I've seen in taking those photos as well is the masks help obscure some things. They obscure some of the characteristics of people. What they haven't obscured, at least, is the differences that people struggle with. And you can still see who's poor and who's not. And in Geneva, Geneva is not a city where many people struggle, but it still shows the difficulties that are variable. And here, elderly people struggle because of neglect or of the lack of attention or of loneliness, and that still was the case. And it made them even more lonely to be behind masks and being unable to interact with it affected the psychology of people, including children. And one of the photos is of my children with my wife in a library. Children didn't have to put masks, but they had to cope with the absence of facial expressions of all the adults in their lives. So all those are things that we have to explore, and those cannot be explored by medical professions only. We need to start thinking of health phenomena at this scale as a multidisciplinary thing that needs to be examined from all angles.
Thank you, Dr. Tammam. So, as you were saying, this is not an issue that health professionals alone can tackle. So, a scheme that came up once the pandemic started, and one where the WHO was involved too, was COVAX, which, for viewers who are not familiar with it, was essentially a scheme to distribute vaccines to lower income nations with help from more wealthier nations and donations from other institutions. So this was supposed to be a game changer, but obviously, as we know, even as of now, it hasn't been as successful as we've expected it to be. So why do you think this is the case?
So one thing about COVAX that is unique is not only that it's rich nations helping poor nations, it also is based on the premise that everybody pays what they can. So all the nations that engaged in COVAX paid something. No one received anything for free. The problem with COVAX is that the same nations, the rich nations that were talking about the vaccine becoming a public good and available for everybody without discrimination, started themselves turning away from using COVAX as the single mechanism, and started buying stuff like crazy. If you remember the images in the early days of the pandemic when people went crazy buying toilet paper in supermarkets, that's pretty much what happened in COVAX. Then rich countries didn't only allow COVAX to negotiate prices with pharmaceutical companies, they went and bought everything they can, which immediately affected the availability of vaccines for COVAX. So the last I know is COVAX was supposed to vaccinate 20% of all the 20% of the populations of all the country, and they barely reached 2 or 3% in most places. And that's because countries in the West, Canada, the US, most European countries, ended up buying many times the amount they need. And you might think, oh, but why would they even buy 5 times like Canada did the amount they need? This is just a waste. And the reason is when they started buying, no one knew which vaccine would actually turn out to be effective. So they ended up going and sort of reserving, negotiating big purchases from every company that was developing vaccine. We were lucky, and most of the vaccines turned out to be effective. But that didn't lead immediately to, okay, let's give the rest to COVAX. We're still seeing some countries that bought too much, thinking, oh, we might or might not donate some, and at the same time, still COVAX is unable to fulfill the um, global need. So what that did is there's a domino effect to that. Once the rich countries start hoarding vaccines, everybody else loses faith in COVAX and start trying to get deals themselves, which further undermines the system. So I don't know if you've seen, The Lancet is one of the more reputable medical journals, and their recent cover is about the failure of COVAX because of the selfishness of rich countries.
Thank you, Dr. Tammam. So we can't discuss the pandemic and its consequences without looking at its mental health repercussions. And you've already touched on it about loneliness and such. So what we've noticed is that a lot of people, especially under the context of poverty and hunger, loss of job, unequal access to healthcare, and so on, and people who already have existing mental health issues, they've seen their conditions worsen during the pandemic. How do you think we can address this problem? And since all of these problems have gotten worse because of the pandemic, do you think we could have started doing something before?
So to start from the last bit, yes, we could have done something before, not only about the mental health issues, but about any aspect of it. If in a non-historical world, you might be tempted to think that this is normal, this is like a once in a century event. It isn't. And I was sort of, during my career, I was put several times in the path of a pandemic or a potential pandemic. I worked in Indonesia in 2005 after the tsunami, when the H5N1, the influenza virus, started infecting birds in Indonesia, and it threatened to become a human-to-human transmitted, potentially pandemic. That luckily didn't happen. I was working with the Red Cross in 2009 when the H1N1, which is another, what was called at the time the swine flu, came out of pig farms in Mexico and became a pandemic, but luckily was not virulent enough to cause massive mortality. It did kill a lot of people, but it wasn't the worst case scenario, at least, and that was lucky. We know that the SARS happened. So we know that the Middle East respiratory syndrome, which is another coronavirus, happened, and we were lucky enough that it didn't spread as much as that. So I know for a fact that there have been every element to know that a pandemic is coming at one point, and that there have been many efforts to prepare for it. But because, in my opinion, the short-sightedness is not the lack of science as much as the lack of political will. And think about it, most of the governments, even in democracies, are more invested in stuff that will win them the next elections rather than in stuff that might or might not happen in the next many years. And if you are concerned about winning the elections, you have other things to make visible. So people discount risks in the sense of that will happen, hopefully will happen to the next government. I'm concerned with getting elected. And this is one of the dangers, and why while health and healthcare management needs to be democratic, need to be concerned with the wants and needs of people who are affected by health risks. It doesn't fit always neatly in the party politics and the current politics of countries. All that being said, the mental health consequences were devastating, and I think they will continue to be so. And I mentioned, Geneva, where I live, is by no means one of the worst affected places. There have been difficult days, and the control of the pandemic wasn't always straightforward and easy. but people have recourses. There's social security. There are places where people lost their income the moment they stopped going to work or had to go to work at risk to themselves and their families. There were places where people had to isolate alone, or they had to accept the risk because they couldn't isolate. They lost income, they lost family members, they lost loved ones, and so on. And all that is unmanageable because, like, the closest I can think of is conflict, is war. When you lose a parent or a child in normal times, this is devastating. When you lose a parent or a child in a pandemic or in a war, it becomes one of the many. And I've seen close friends and very close people to me lose close ones. And then you sit and for once as a health professional, you see the sense of loss and agony, which we understand theoretically, but which gets lost once you start talking about people as numbers. When you say 2 million people died, that's a lot, obviously, but that's a number. And then you sit and see someone who's lost their parents to the disease, and you think, okay, all that pain is multiplied 2 million times. That's a different story entirely. So this is the risk. We once we start looking at something ununderstandable because it's so massive, we lose track of those of the devastation, and the devastation is mental, and the inability of people to grieve normally or to be able to process their feelings or to process their losses, whether economic or in life or and so on, is going to take a lot of time. Like many conflicts and wars, it's not something you finish and get over. There is a collective psychological impact that will need to be gotten over. That, and of course, an economic one, because as you will have known from the news, the richest people of the world got much, much richer during the pandemic. The poorest didn't. They lost a lot, and it'll take a lot of time for those losses to be recovered.
Thank you, Dr. Tammam. So another topic that I'd like to talk about is the spread of false information during the pandemic. And we've seen this almost everywhere. People have, in a sense, people don't know what's happening, and there's this fear of the unknown when their whole life is turned apart. And we see a lot of false information, misinformation being spread around, and especially in the early days of the pandemic when guidelines were being revised and people didn't understand what's going on. What do you think we can do about this? Do we need to focus on improving education and spreading the right information?
Yeah, I agree. We do need to focus on emphasizing the right information and on making it available and simple and understandable to people. Look, there are hardly any topics that are impossible to explain in reasonable language that is understood by anyone. And I often find that the overcomplication of issues, especially in the public debate, in the public square, is due to um, it helps the self-importance of people who say complicated stuff more than it does the topic itself. No one expects you to explain, mRNA vaccine in absolute biological or physiological details to the people. But it's absolutely important to explain how does it work, how is it different, what do people expect out of it in language that even a child can understand, because otherwise you lose it. And here we have the dilemma of our age in a way. It's much harder to tell facts than to tell lies because you don't have to be careful and considered and precise when you tell lies. If you want to say a full lie, which is, forget about the pandemic for a moment. We've had vaccines for decades as part of our everyday. And if there are people who still say wrongly and absolutely misguided that vaccines cause autism, for example, or are not good for you or are poisonous, they really don't need to be careful. They don't need to avoid contradictions. They don't need to have the same story. They don't need to re-examine theirs. It's a false piece of information. It's easy to spread. It's a soundbite. to counter that with real scientific information that are both precise but also considered and understandable and evidence-based and considered of the cultural and social and economic and so on background that people receive the information from is a lot of work. Hence, you find usually that precise information are dense and complicated and so on, and the false information are pretty simple. The other thing is there has always been false information. There has always been contested information. You go in medical history, and even after, there were many theories about why disease spread. And one of them was the germ theory, that there are microorganisms, and one of them was called miasma, or bad air spreads disease. And even after the germ theory was proved in the 19th century, beyond doubt, the miasma proponents continued. Scientists, some of the best scientists of their day, continued to spread that, but this is not right. This is what we thought was more important or more true. There's always been that, but we are in a hyper-connected age. I don't need to explain that. We have massive amounts of information and ways to amplify information and ways that are malevolent. So, the armies of bots and hackers and, bot factories and so on that are meant to spread false information for political gain are a fact. We know about that. So you mentioned education and knowledge on precise information, and that's absolutely true. But that is one layer. And I think there are several layers without at least looking at the attempts at education is going to hit the same wall of false information and other forces. And I think there hasn't been necessarily enough transparency about things, even in democratic countries, even in the West, even rich countries. I haven't at all, except very rarely, felt that the governments who are sometimes very rightly taking actions like lockdowns, like the guidance they gave, didn't put their process of thought openly to their populations, didn't discuss it, didn't allow a public debate to develop. This was dealt with in a military fashion in many cases. We are the government, we know what's better, your job is to listen to us. And that might be needed in extreme situations, but I don't think it can be sustained forever. There needs to be a public debate. There needs to be a discussion of the available information. There needs to be testing on what actually works and what doesn't, and what people are willing to tolerate and what not, and allow people to have some agency and sovereignty in deciding what is more important once everything is put on the table transparently. So the cost of lockdown is so and so. But if that costs me my livelihood and my kids will go starving, then I have a different calculation from someone who has a villa in, or you've heard the news, some people took their yachts to the sea to isolate. That's a different thing. And there's no one size fits all. And it needs to be debated democratically when that's possible. And my argument is that that's much more possible than it was practiced even in the most democratic countries. So there is much to be desired, and people will listen when they feel respected and told the truth. Because one of the easiest things to say by whoever is spreading false news is there's a conspiracy. They're lying to you, and it's hard to dispute it when you don't feel that you're being told the truth transparently and with respect and acceptance of one's agency.
So, given the way people continue to encroach on animal habitats, trade, wildlife, and also the high amount of air travel we have globally, it's quite likely that we may see another pandemic in the future. So, based on what we've dealt with COVID-19 so far, what lessons do you think we can learn, and how do you think we can prepare for a potential future pandemic, especially from the lens of major institutions and governments?
Yeah. Well, that's interesting. So if I don't think there's a dispute that infectious diseases will continue to spread, and whether they take this exact shape of pandemic or any other scenario. I'll give you a couple of more scenarios at least. Malaria wasn't always in a belt in mostly Africa and Asia and Latin America. Malaria existed in the United States extensively up to the Canadian border almost. It existed in Southern Europe. It existed extensively in Italy. And there is a scenario whereby infectious diseases that are all diseases have a resurgence in places where they don't exist. Either go back to places where they've been taken out of, or start encroaching on other places. We have examples there. Changing climate has allowed malaria, for example, to spread in higher altitudes. In Addis Ababa in Ethiopia is one of the places that have become more endemic with malaria as temperatures went higher. So one of the things I've worked once on a situation where an outbreak of dengue fever happened in Capo Verde, and it's an island of the coast of Africa, and it didn't have dengue fever. So when it had the mosquitoes, but when the infectious agent was introduced, ended up causing an explosive outbreak. And that's especially the case because people didn't have any immunity to it. So one of the scenarios that scares me is the resurgence of all diseases in whether diseases or because of the temperatures and the climate, like malaria, for example, or dengue or chikungunya or others, spreading in places where people have no immunity, or diseases of poverty like tuberculosis and others that become more prominent, especially as more people are thrown out of the of a livable status, even in the inequalities increase and so on. So this is one thing. Another is another pandemic, and I say all that because it would be probably short-sighted if all efforts now go towards identifying the next pandemic, ignoring all the other health inequities that are killing people and affecting their life and livelihood. So I suppose what I'm arguing is, if we've learned something, it shouldn't be to re-emphasize the global health security agenda, which worries more about protecting the rich from the diseases that emerge among the poor, like COVID disease, and concern ourselves with establishing situations whereby health equity is more likely and the health systems function. And in that circumstance, there will be more likely possibility to identify new diseases, deal with them rapidly, expect them to not spread and become devastating before all the resources are mobilized. And of course, there needs to be surveillance, there needs to be identification, but it needs to be more equitable, not only to identify staff that might jump to US and Europe and so on, but also things that won't, but are still important because they will cause devastating health consequences.
Thank you so much for your insights, Dr. Tammam. I'll hand the floor over to Rumana now.
Thank you, Sanjana. Thank you, Doctor. Now we're going to shift to a much more lighter note. Now, this year marks the 50 years since Msf Operations. Congratulations. Now, Doctor, what role do you think that Msf has played in the pandemic?
I think, look, MSF is part of a tradition of refusing to accept that crises are inevitable, or the effect or the devastation of crises are inevitable. You have plenty of literature about humanitarianism, about its history, and so on. And humanitarianism is older than the 50 years of MSF. Humanitarianism is as old as humans, because there's always been mutual aid and support and helping people in crises. Well, at least modern humanitarianism even that is older than MSF by a while, and it's based on we have reached a stage in civilization where people shouldn't be devastated without any aid from the outside. And MSF added something to the equation when people created MSF. they added something to most of them worked for the Red Cross before, which is it's not only unfair that people don't get aid in emergencies, in conflicts, but we also have to stand witness and help allow people deliver their voices and expose the exploitation and the devastation that happen. In that sense, most of my experience during the pandemic with the MSF was with the Access campaign. And the Access campaign comes from the early days of HIV, um, when the available medicines, the highly active antiretrovirals, were unaffordable, were thousands of dollars per patient because they were patented and they were um, well, they were just expensive. And MSF and others, many, including patient groups and other activists, argued that we need to have generics that are affordable because people's lives are more important than the profits of pharmaceutical companies. And that led to the creation of the Access campaign and to 20 years of dealing with the access issues. In the pandemic, it was fairly obvious at an early stage that, even when a vaccine, no matter how fast a vaccine would come, it is likely to be um, patented, it's likely to become expensive, and it's likely to be exclusive to the rich. Now, that's one thing. We could have seen that coming, and this is part of the work that Msf Access campaign did. Another part is the fact that there is billions of dollars of public funding, taxpayer funding, that went into the research and development of the vaccines. So whoever tells you, oh, but those are companies, they need to make profit to make it worth their while to do research and development. The research and development was subsidized by public funding. What MSF Access campaign asked for repeatedly is if you get money from governments, then you should have an obligation to make it accessible to people, to make it affordable. Not only the governments um, that paid it, but in a public setting. The third one is, look, this is a global health crisis. Something needs to matter more than the profits of pharmaceutical companies. And if we manage to go through a pandemic which has killed all those people, affected all this, and still the profit of pharma companies is more important, then we have something fundamentally broken. And we have to look at that more seriously. So there was focus on the availability of medicines, on putting conditions on public funding so that medicines and vaccines go to people who need them most first. But there's also an argument against what ended up being all the nationalist tendencies of governments. So it's not only about the availability and prices of drugs, it's about governments reverting to the most basic, narrow forms of nationalism. I want to vaccinate everybody in this country, even people who are not at risk, not this country, as a government, before I give anything away. So I don't care if healthcare workers or elderly people die somewhere else, as long as I can vaccinate everybody. And even that, even nationalism, if it's ever justifiable, stops being justifiable when it's that vulgar and at the cost of the lives and well-being of others. So all those issues governed access during the pandemic, and MSF was engaged through the Access campaign and other MSF entities in tackling many of them, talking about them, analyzing and understanding and doing advocacy directly and publicly.
Right, thank you for that answer. You also mentioned how humanitarianism just exists simply because we are human. Now, we have seen that there is a rise in global humanitarian services, and there's an unprecedented awareness of civil rights and civil welfare. So, the youth now are more socially active than they have ever been before. So, Doctor, what advice would you give to the younger generation who are going along this path of humanitarianism?
Yeah. So, I've spent 20 years of my life working in the humanitarian sector, and I've come across people, incredible people, dedicated and truly, truly humanitarian in the most benevolent and kind way of this. But we have a system of humanitarianism that is based upon an understanding of this as charity, as a choice that the rich should give the poor because of the kindness of their heart. So they don't have to, but they do. And that becomes more and more bold as the humanitarian system and part of the aid system altogether, the development aid and others, become bigger, become more institutionalized, and become more donor-driven, and become and obviously the needs are unending, and the resources that are available are not enough. So I don't think the model of charity that is not an obligation but a kindness is sustainable. And I think COVID shows that our no matter how we'd like to think about our privileges, our fates are inextricably linked, and we have to accept that. Before COVID, the biggest crisis that was had was the migration crisis to Europe. Not that it's that important, because the numbers of people who migrated to Europe are a fraction of the global forced displacement numbers. Yet it was made a whole issue, and Europe planted, went from a humanitarian operation into a security operation. They put warships in the sea to prevent the migrants from crossing. Um, and before that, there were always crises. But we are in a time where both the negative politics, the national populism, the exclusionism, the narrow ways of dealing with others has escalated and became norm. If you look at stuff that happened in the US during the administration of the past 4 years, in the UK, political rhetoric that would have been embarrassing a few years ago became the norm. Exclusion, hate speech on daily basis, on TVs and from politicians. And the explosion of reaction. We can't, but many people, can't afford to sit still while racial discrimination and injustice continues. Hence, the Black Lives Matter spread not only in the US after the killing of George Floyd, but globally. We can't sit still and wait until the politics allows itself to deal with the climate crisis. Hence, people are taking to the streets and arguing against it. Now, this is not entirely new. People have fought against capitalism in the form of, the G20 and G7 and G5 riots and protests before. But this is a more political time. And I think those of you guys who are going to go to humanitarianism should first accept that this is not a venture that is directed from the rich countries to the poor countries. This is not anymore a charity and cannot be accepted as such, and should be accepted as an expression of solidarity with people who are affected by emergencies. What that means is not just words. What that means is, if you're doing charity, then you get to call the shots. You get to decide who receives it and who doesn't. And on your own terms, you get to decide what. And that's what happens now. If we're acting out of solidarity, if we're acting out of solidarity, then we have to accept that people have entitlements, that this is a reciprocal and equal relationship, and they get to say what sort of humanitarianism fits them, and we get to adapt to support them, and that's a whole different story. And this is an evolution that I don't think is even negotiable anymore. And we should take it on and make it reality, not as a reaction to pressure, but as a genuine desire to evolve into the next more humane and more appropriate form of humanitarianism. And this is the next generation that's not, hasn't like us gone through the system for too long, that will demand and will change, hopefully.
Thank you for that wonderful answer. Now, the last question is Like, as far as the pandemic is concerned, what lessons have we learned from the pandemic? And what measures can be taken to prevent something as catastrophic as this on this kind of global scale? Do you think that we're better equipped to handle something like this in the future?
Mhm. No, no. I might be cynical. We have uh, more technical capacities now to deal with something very similar. But in my mind, the next large scale problem is not a virus or a pandemic. The next large scale problem is the climate crisis. And think about how difficult it was to organize and to come together to deal with a single virus. This is, mind you, this is one virus, one disease, and one vaccine. And we're still unable to provide any equitable treatment for the world. Think about the climate crisis when diseases change, their endemicity and geography change, when mass population displacement happens because of failure of crops and hunger, where sea level rise will devastate coastal areas, and where that affects everywhere in the world. And think if you can believe that our inability collectively to do something effective and equitable and decisive about this single virus. Mind you, this is not the worst form of a pandemic that could have happened. This is a disease that doesn't kill kids. And thank God for that, because influenza isn't as forgiving. And other diseases are not as. We have gone through a pandemic that doesn't kill children. Thank God, because that would have been a completely different story. Think about having to deal with something as multifaceted and complicated as the effects of climate crisis. And think whether the meager tools of international cooperation that we have now will be sufficient to do something about it, or whether we're more likely to close up even more and think about one's own interest, which would be misguided because it's impossible to deal with them individually as single countries or as single communities. So rather than being pessimistic, I'm optimistic that there are people and groups outside the formal politics that will rise and demand a change to this, that will say, this is not good enough. We're not going to live with it. The world is too risky for us to accept this narrow view of interest and force a change. But if I say, oh, we're fine, I'll be part of this anesthetic that prevents something from happening.
Thank you for that answer, Doctor. We hope such a catastrophe does not happen again in the future, and if God forbid it does, organizations such as MSF and our generation will be better equipped and more willing to take care of it and ensure that minimum casualty happens. Thank you for all your answers that you've delivered with such eloquence and your insights. If it's okay with you, we'd like to now take questions from the members of the audience. There are two questions. One is more towards your gallery, and the other is related to the pandemic, and the catastrophe in areas of unrest. We'll begin with a lighter note. There's a question that says that you took pictures of masked people. What do you think the mask signifies? I think it goes beyond the very obvious thing that apart from the
Well,
fact that
the mask has turned out to be. First, thank Nidhi for the question. This is brilliant. The mask is beyond the piece of cloth and the covering of the mask. The mask has taken political dimensions almost instantaneously. The obvious one is, the mask rejection, for example, in the US and other places, as a limitation on liberty or a conspiracy or and it has cut societies between left and right and conservative and non-conservative and so. And it was used. So this is the first signifier. This is the ideology over reality. People are willing to put themselves at risk to believe the myths that they invent. And I'm not only talking about the anti-mask people, I'm talking about everybody. This is just a signifier of the fact that we are in post-reality world, that ideology is more important than reality. And I'm not saying science is a solution to every problem in the world. There are social and ecological and economical problems that have more dimensions. But we are there. The second one is masks are. I found it that people got too comfortable with masks, too not comfortable with the breathing and stuff, with the elimination of identity. We are in a world um, where people want isolation. They want to separate from each other. It feels to me sometimes that is, and this is almost anti-evolutionary, because part of the reason humans have the expressions, the ability to express our faces the way we do, is because this was a social instrument. So if you were, 15,000 years ago, a hunter-gatherer, you needed to be able to judge the hostility or friendliness from someone from far away by their facial expressions, by their body language. That's why we are so skilled at doing it. Now we are safe enough in our social isolation that we don't even need to measure people's expressions, and that's a bit scary. The last one I will say is masks are a problem that, well, I couldn't call it exactly that, but it's an issue of hypocrisy, because when liberal democracies that that sanctify individual freedom decided to prevent niqab, for example, in France and Germany, I think, and others, or Austria, I'm not sure. Their argument was first that we're protecting women. And when the women told them to piss off because it's not their job to protect them, they said, oh, but this is a security risk. We can't have people with covered faces run around the street. And don't you know it? Now everybody runs with covered faces. You'd think that this being the case, someone will run and reverse that law, but they didn't. And the hypocrisy in that is, how can we differentiate between those who force women to cover up and those who prevent them from covering up? They do the exact same thing using the exact opposite arguments. But it's always guys, it's always men who know better. And that is, every time I see people in masks, this comes back to me. Oh, now we don't know the identity of anyone, but yet no one freaks out as they did, because, there are 20 women who choose to cover their faces in Paris, and everybody's scared of them. But no one's scared of us, now the hordes of humanity who have no identities in the street anymore.
I think that was a brilliant answer. Following up to that, my personal question is that you mentioned elimination of identity. While there is, like you mentioned, problems with, going expressionless, as in the deprivation of social instrument expressions and the kind of connection we have when we understand each other through nonverbal cues. Do you think it has also helped people of certain minorities and certain identities that didn't feel safe and that didn't feel seen come out more now and feel more comfortable that there is a social blur which does not make them stand out from the majority? It's easier to blend in that aspect of wearing a mask. Do you think that's a phenomenon that has come out of wearing masks?
I really hope it would be, but I am doubtful. In societies of exclusion and fear and so on, doesn't really help. So I'll tell you a little story that jumps to my mind. A friend of mine who's Romanian and her husband is French has a kid who's like 17 or something. And he had a hoodie and a mask one day. And he was shouted at in the street in France and was told to go back to his father's kebab shop. So rather than, rather than people of minorities feeling more safe, it has become, a white kid got mixed for a brown kid. And of course, the racial slur is that, of course, he's a brown kid, so he must be coming from a kebab shop. So the problem is, I don't know the justification. I don't think it helps. The covering up the elimination of, and it tells you several things. I don't know what the conclusion is, but there's no way that you can expect everybody to assimilate in a unified culture and then survive, because that's not enough. And covering up is not likely to work. I can't imagine how a black person or a brown person or a person of a minority will stop appearing like that. We are extremely skilled as humans at figuring those stuff out. So it's not like it's going to cover everything. And it will just make it even harder to avoid those little discriminations. I really hope it helped anyone, because if anything, people who are subject to harassment and problematic behavior deserve a break. And if that was it, then it would be a good thing.
Thank you for your answer. I hope it answers Nidhi's question too. Now taking the second question we have, it says, how can MSF operations be improved to better accommodate civil unrest and schisms in areas of operation? This is a little heavier than the
Well, I
previous
think no, but I think it's a significant question, and I think MSF operations improve and adjust themselves all the time. We're 50 years now. When HIV came, there was plenty of change towards addressing HIV, and you cannot address HIV without addressing poverty and exclusion and minorities, and so that changed. MSF changed when civil unrest happened in several African countries, in the Balkans and in Afghanistan in the 90s, because you have to change to address something you're not used to. It changed when Afghanistan invasion happened and Iraq invasion happened. And it changed after the Arab Spring and the conflicts in Yemen and Syria and Libya. So it is a dynamic thing. Now, does it change always exactly in time and towards the most optimal form? Of course not. It's a complicated thing. You have operations in 70 countries and treat 12 million patients a year. That doesn't, it's not as easy to engineer, because not all the variables are clear. Now, what I think is significant constantly for humanitarianism to address is, what do we think constitutes a humanitarian crisis? And that used to be conflict, like armed conflict. Obviously, it became civil wars as well. But then we are in a time where we have to decide whether political oppression or social exclusion, or the oppression of minorities, or so, or violence that isn't officially, like gang war, drug cartels, stuff like that, or whether environmental exploitation constitute humanitarian issues that we should be concerned with. And that is not an easy question to answer, because it's obviously war. You have bombs and bullets and people in need of medical care. In political oppression, it's not always the same indicative. But this is a self-examination that needs to continue and needs to be self-critical and open. And in this day and age, it's not enough for it to happen at MSF's or any other humanitarian organization's headquarters in Europe. It needs to happen across the whole of MSF, including the 90% who are national staff, come from the countries of operation, and who should have a voice in the organization commensurate to their sizing. That has not always been the case, and it deserves to be re-examined.
Well, that was a very comprehensive answer. We hope to become a generation that supports local voices and the voices of native people in terms of in the way they operate and the way they function. We have one last question, which says, "Why are all you have answered this in one of your previous answers, but we'd like more light on this. Why are all your photos related to COVID-19 in black and white?" It comes from Dalia Elaked, I think, and she says that they found all your pictures wonderful. Great work.
Thank you very much. I think it's partially, as I said, it's a tradition in street photography that comes from the days of its creation, and many people still carry that sense that street photography happens in black and white because it's more of a documentary photography, and this is sort of a historic form, right? The other one is I find it forces us to look at people's faces and expressions and body language more. And you have to compose them in a certain way to attract people to what you want to tell them in the photo. That is more clear to me in black and white without the distraction of colors that might not serve that story. And ultimately, I take photos because I like them, and I like black and white photos more than color ones most cases.
Thank you for that answer, Doctor. Also, it's art. It's very subjective. As a viewer, you can interpret it in any way. And we hope that our audience here supports Dr. Tammam's gallery and all his future projects. Thank you, Doctor, for joining us today and for taking time out of your busy schedule for us. We hope all our viewers have had a great time listening to the doctor shed his insights on such important topics that need to be discussed. We hope you guys have a great day ahead. Thank you for joining.
Have a good day. Thank you very much.
Thank you once again, Doctor. Thank you.
Bye.